It's crucial for the state and the country's efforts to accurately assess this crisis, how far widespread it is. Here with some insight is Dr. Dasgupta, pulmonary and critical care physician with USC. Dr. Raj, thank you once again for joining us. We know how important it is for those with symptoms to be tested to find out whether they are spreading the disease around. How about for those that don't have symptoms? We just received an email today about someone who may not have had COVID-19, wondering if they should get that antibody test.
Yeah, Jory, in a perfect world, everyone needs to be tested, no questions asked. But we do have guidance from the CDC, but these rules about testing change from state to state and hospital to hospital. And historically, when the pandemic started, we were not testing asymptomatic people. We were not even testing people with mild disease. And the reason being is that, number one, we definitely had limited testing. We're improving on that. We're improving the infrastructure, but we're far from being perfect. Number two, safety. Safety for the patients and for our medical staff. And last is, it didn't really affect my clinical management, what I had to offer the patients, staying at home, watching the symptoms, staying well hydrated. But things are changing as we speak, meaning that we are testing people with mild symptoms. And it is imperative that we do this because we are now opening up the country. And now that we're doing that, you mentioned asymptomatic, we don't have good guidance in what we're going to do. And hopefully, because we're doing antibody testing, we're looking for immunity, this could help it out. Because my gut tells me that this may be a little premature about opening up the country, and with all the hard work that everyone's been doing, it really only takes one person to start off this pandemic again.
Yeah, and we just saw the president today say he's going to use the power of the federal government to get more of those swabs. That was just one of the many shortages we've seen with the nasal swab testing, not with the serology. A different topic here. You also treat patients with sleep apnea who may use one of those CPAP masks to breathe at night. Any additional concerns that those people should be aware of?
You know, people with sleep apnea, there's not a direct correlation to getting COVID-19, but people with obstructive sleep apnea are older in age, have diabetes, high blood pressure, and heart disease. And those are the things we worry about the most in patients who have COVID-19. So I would say if you do have sleep apnea, keep on wearing your mask because the fact you need good quality and quantity of sleep to keep your immune system up. But if you have COVID-19, there is some data out there that by wearing this CPAP mask, you may actually spread the virus to people in the household. So before you stop it, let your doctor know that you are COVID-19 positive, and they'll give you some guidance on what to do.
Always smart, and got to clean those CPAP masks to begin with initially.
You do.
Yeah, Dr. Raj, a lot of people are going on walks right now. The flowers are blooming. It's beginning to be spring. It's kind of allergy season. People find themselves sniffling and sneezing again. If you ever go outside and hear one person sneeze or cough, you know all eyes just dart right to them. It's not a good time to go outside and cough or sneeze right now. How about patients that are concerned about getting those allergy symptoms and worrying that they may have COVID-19 or somehow make them more susceptible to it?
Oh, Jory, that is a great question. This is the first allergy season we're sharing with COVID-19, and you're right. My patients are asking me, what are my symptoms? Is it allergies or COVID-19? So my tip for everyone listening today is that if it's going to be allergies, think of the itchies, the itchy eyes, the itchy nose, the itchy throat. And if it's going to be COVID-19, let's stick with our three big symptoms. Fever. Probably not going to be allergies when you have fever. Think about the cough and shortness of breath. But one of those overlap symptoms with COVID-19, people were talking about that lack of smell. But remember, you can get that too when you have bad allergies, when you get that stuffy nose. So if your traditional allergy treatment's not working, time to let your doctor know that, hey, do I need to be tested? And let me just add one more thing, Jory, is that many of my allergy patients do have asthma, and any virus can flare up your asthma. So if you have it, make sure you have enough of your medications, you're taking your medications, and if you do get a flare at this time, make sure that your physician has given you an asthma action plan to tell you what to do if you do get a flare-up.
Great advice as always. And of course, if you're outside, you should be wearing a mask. So if you do sneeze from allergies, you are covered there, but always good to let everyone know around you. It's just an itchy nose, everybody. Everyone's safe. Go about your business. Dr. Raj, thanks so much for joining us. We appreciate the information as always.
You're welcome, Jory. Thank you, too.